Post-traumatic stress disorder, or PTSD, is a mental health condition that can develop after experiencing or witnessing a traumatic event. While many people may experience distress following trauma, PTSD is characterized by persistent and severe symptoms that interfere with daily life. In this video, we'll explore the most common symptoms of PTSD, helping you understand what to look for and how these symptoms can impact individuals. Recognizing these signs is the first step towards seeking help and supporting those affected. Let's begin by understanding what PTSD is and why it matters. Trauma can result from a wide range of experiences, such as accidents, natural disasters, violence, or military combat. Not everyone who experiences trauma will develop PTSD, but for some, the effects linger and become disruptive. Understanding the nature of trauma is crucial for recognizing PTSD symptoms. Trauma can impact both the mind and body, leading to emotional, psychological, and even physical responses. By defining trauma, we set the stage for understanding how PTSD manifests and why its symptoms can be so challenging. PTSD symptoms are generally grouped into four main categories: intrusive memories, avoidance, negative changes in thinking and mood, and changes in physical and emotional reactions. Each category represents a different way that trauma can affect a person's life. These symptoms can appear soon after the traumatic event, or may surface months or even years later. Understanding these core categories helps us recognize the complexity of PTSD and the varied ways it can present in different individuals. One of the hallmark symptoms of PTSD is the presence of intrusive memories. These can include recurrent, unwanted, distressing memories of the traumatic event, flashbacks where the person feels as if they are reliving the trauma, and upsetting dreams or nightmares. Intrusive memories can be triggered by reminders of the trauma, making daily life unpredictable and distressing. For many, these memories are vivid and emotionally charged, causing significant anxiety and discomfort. Flashbacks are a particularly intense form of intrusive memory. During a flashback, a person may feel as though they are actually experiencing the traumatic event again, complete with the same emotions, sensations, and even physical reactions. Flashbacks can be triggered by sights, sounds, smells, or other reminders of the trauma. They can be brief or last for several minutes, and often leave the person feeling disoriented or distressed afterward. Nightmares related to the traumatic event are common in PTSD. These nightmares can be so vivid and distressing that they disrupt sleep, leading to insomnia or poor sleep quality. Over time, the fear of having nightmares may cause individuals to avoid sleep altogether, resulting in fatigue and further impacting mental health. Sleep disturbances are a significant challenge for many people with PTSD, affecting their ability to function during the day. Another common symptom of PTSD is avoidance. People may go out of their way to avoid places, people, activities, or conversations that remind them of the traumatic event. This avoidance can extend to thoughts and feelings as well, with individuals trying to suppress memories or emotions related to the trauma. While avoidance may provide temporary relief, it often leads to isolation and can make it harder to process and heal from the trauma. Emotional numbing is a form of avoidance where individuals feel detached from their emotions or surroundings. They may have difficulty experiencing positive emotions, feel disconnected from loved ones, or lose interest in activities they once enjoyed. This numbness can make relationships challenging and contribute to a sense of emptiness or hopelessness. Emotional numbing is a protective mechanism, but it can also prevent healing and connection. PTSD often brings about negative changes in thinking and mood. Individuals may develop persistent negative beliefs about themselves, others, or the world. They might feel guilt, shame, or blame themselves for the traumatic event. These negative emotions can be overwhelming and persistent, making it difficult to see hope for the future. Such mood changes are a core aspect of PTSD and can deeply affect daily life. A common symptom of PTSD is a marked loss of interest in activities that were once enjoyable. This can include hobbies, socializing, or even spending time with family and friends. The loss of interest is often linked to emotional numbing and negative mood changes, and it can lead to withdrawal from social life and increased feelings of isolation. Recognizing this symptom is important for understanding the full impact of PTSD. People with PTSD may feel detached from others, even those they care about deeply. This sense of detachment can make it hard to connect emotionally, leading to strained relationships and a sense of loneliness. The feeling of being cut off from others is not intentional, but rather a symptom of the disorder. It's important to recognize that this detachment is a sign of PTSD and not a reflection of the person's true feelings. PTSD can cause individuals to blame themselves or others for the traumatic event, even when it is not justified. This distorted sense of blame can lead to feelings of guilt, shame, and low self-worth. It may also affect relationships, as the person struggles with anger or resentment. Addressing distorted blame is an important part of PTSD treatment and recovery. Memory problems are another common symptom of PTSD. Individuals may have trouble remembering important aspects of the traumatic event, or they may experience general memory difficulties. These memory issues are not due to lack of effort, but rather a result of the brain's response to trauma. Memory problems can add to the frustration and confusion experienced by those with PTSD. Many people with PTSD find it hard to concentrate or focus on tasks. This difficulty can affect work, school, and daily responsibilities. The mind may be preoccupied with intrusive thoughts or anxiety, making it challenging to stay present. Concentration problems can lead to decreased productivity and increased frustration, further impacting self-esteem and daily functioning. PTSD can lead to a persistent negative outlook on the world. Individuals may feel that the world is dangerous, that people cannot be trusted, or that nothing will ever improve. This negative worldview can reinforce feelings of fear, anxiety, and hopelessness, making it difficult to engage with life and relationships in a positive way. Hyperarousal refers to a state of increased alertness and sensitivity to potential threats. People with PTSD may feel constantly on edge, easily startled, or have difficulty relaxing. This heightened state of arousal is the body's way of staying prepared for danger, but it can be exhausting and interfere with daily life. Hyperarousal symptoms are a key part of PTSD and can be very distressing. Irritability and anger outbursts are common in PTSD. Individuals may have a short temper, become easily frustrated, or experience intense anger over minor issues. These emotional reactions can strain relationships and make it difficult to interact with others. Recognizing irritability as a symptom of PTSD can help in finding healthier ways to manage emotions. Some people with PTSD may engage in self-destructive or risky behaviors, such as substance abuse, reckless driving, or unsafe sexual practices. These behaviors are often attempts to cope with overwhelming emotions or to escape from distressing memories. While they may provide temporary relief, self-destructive behaviors can have serious, long-term consequences for health and well-being. An exaggerated startle response is another symptom of PTSD. Individuals may jump or react strongly to unexpected noises or movements. This heightened startle reflex is part of the body's survival mechanism, but in PTSD, it becomes overly sensitive. The exaggerated response can be embarrassing or disruptive, making it difficult to feel safe in everyday situations. Beyond nightmares, people with PTSD often experience general sleep disturbances. This can include trouble falling asleep, staying asleep, or waking up too early. Poor sleep can worsen other PTSD symptoms, such as irritability, concentration problems, and emotional instability. Addressing sleep issues is an important part of managing PTSD. Many individuals with PTSD find it hard to relax, even in safe environments. The constant sense of danger or unease keeps the body and mind in a state of tension. This inability to relax can lead to muscle aches, headaches, and other physical symptoms, further impacting quality of life. Learning relaxation techniques can be helpful in managing this symptom. PTSD doesn't just affect the mind, it can also cause a range of physical symptoms. These may include headaches, stomach problems, chest pain, or dizziness. The connection between mind and body means that emotional distress can manifest physically, sometimes leading to frequent doctor visits or unexplained medical issues. Recognizing the physical side of PTSD is important for comprehensive care. Anxiety is a common companion to PTSD. Individuals may feel constantly worried, tense, or fearful, even when there is no immediate threat. This heightened anxiety can make it difficult to concentrate, sleep, or enjoy life. It often goes hand in hand with other symptoms, creating a cycle that is hard to break without support. Some people with PTSD experience panic attacks, which are sudden episodes of intense fear or discomfort. Symptoms can include a racing heart, shortness of breath, sweating, and a sense of impending doom. Panic attacks can be triggered by reminders of the trauma or occur unexpectedly, adding to the distress of living with PTSD. PTSD often leads to social withdrawal, where individuals pull away from friends, family, and social activities. This withdrawal can be due to avoidance, emotional numbness, or fear of being misunderstood. Social isolation can worsen feelings of loneliness and depression, making recovery more challenging. Support from loved ones is crucial in overcoming this symptom. A sense of hopelessness about the future is common in PTSD. Individuals may feel that things will never get better or that recovery is impossible. This hopelessness can contribute to depression and make it difficult to seek help. Recognizing this symptom is important for encouraging hope and resilience in the recovery process. PTSD can make it hard to trust others. even those who are close. This lack of trust may stem from the traumatic event itself or from negative beliefs developed afterward. Difficulty trusting can affect relationships, making it hard to form new connections or maintain existing ones. Building trust is a gradual process in PTSD recovery. A persistent feeling of being unsafe is common in PTSD. Even in secure environments, individuals may feel threatened or vulnerable. This sense of danger can lead to hypervigilance, where the person is constantly scanning for threats. Feeling unsafe can make it difficult to relax, sleep, or engage in normal activities. PTSD can make it hard to experience positive emotions like joy, love, or satisfaction. This symptom, known as anhedonia, can lead to a flat or numb emotional state. The inability to feel joy can affect relationships, motivation, and overall quality of life. Recognizing anhedonia is important for understanding the full impact of PTSD. Feelings of guilt and shame are common in PTSD, especially if the person believes they could have done something to prevent the trauma. These emotions can be overwhelming and persistent, leading to self-criticism and low self-esteem. Addressing guilt and shame is a key part of PTSD treatment, helping individuals move towards self-compassion and healing. PTSD symptoms can be overwhelming, making it hard to cope with daily life. The combination of intrusive memories, anxiety, and emotional numbness can leave individuals feeling exhausted and unable to manage responsibilities. Feeling overwhelmed is a common experience and a sign that additional support may be needed. Decision-making can become difficult for people with PTSD. The constant stress and anxiety may make it hard to weigh options or feel confident in choices. This indecisiveness can affect work, relationships, and daily life, adding to the sense of frustration and helplessness. Emotional outbursts, such as sudden crying or anger, are common in PTSD. These reactions may seem out of proportion to the situation and can be confusing for both the individual and those around them. Emotional outbursts are a sign of the intense emotional turmoil caused by PTSD and highlight the need for understanding and support. The stress of living with PTSD can take a toll on physical health. Chronic stress can contribute to high blood pressure, heart disease, and other medical conditions. It's important to recognize that PTSD is not just a mental health issue, but one that affects the whole body. Addressing both mental and physical health is key to recovery. PTSD can erode self-esteem, leaving individuals feeling unworthy or incapable. This loss of confidence can affect all areas of life, from work to relationships. Low self-esteem may also make it harder to seek help or believe in the possibility of recovery. Building self-esteem is an important goal in PTSD treatment. Feeling emotionally numb is a common experience for those with PTSD. This numbness can make it hard to feel joy, sadness, or even anger. While it may protect against overwhelming emotions, it also prevents connection and healing. Recognizing emotional numbness is important for understanding the full impact of PTSD. PTSD can make it hard to express emotions, even when they are felt deeply. Individuals may struggle to communicate their feelings to others, leading to misunderstandings and frustration. Difficulty expressing emotions can hinder relationships and make it harder to receive support from loved ones. A sense of loss of purpose or meaning in life is common in PTSD. Individuals may feel disconnected from their goals, values, or sense of identity. This loss can contribute to depression and make it difficult to find motivation for recovery. Reconnecting with purpose is an important step in healing from PTSD. PTSD can leave individuals feeling powerless or out of control. This sense of helplessness may stem from the traumatic event itself or from the ongoing struggle with symptoms. Feeling powerless can make it hard to take steps toward recovery, but recognizing this feeling is the first step in regaining a sense of control. Planning for the future can feel impossible for those with PTSD. The focus on surviving day to day may leave little energy for setting goals or making plans. This difficulty can contribute to a sense of stagnation and hopelessness. Encouraging small steps and celebrating progress can help rebuild hope for the future. PTSD can strain relationships with family, friends, and partners. Symptoms like avoidance, emotional numbness, and irritability can make it hard to connect and communicate. Relationship difficulties are a common consequence of PTSD, but with understanding and support, healing is possible. A loss of motivation is common in PTSD, making it hard to start or complete tasks. This lack of drive can affect work, school, and personal goals. The combination of fatigue, negative mood, and hopelessness can make even small tasks feel overwhelming. Recognizing this symptom can help in finding ways to rebuild motivation. Physical tension, such as muscle tightness or jaw clenching, is common in PTSD. The body's stress response can keep muscles tense, leading to discomfort or pain. Physical tension is a sign of the ongoing stress and anxiety experienced by those with PTSD, and relaxation techniques can be helpful in managing this symptom. To summarize, PTSD is a complex condition with a wide range of symptoms affecting both mind and body. The most common symptoms include intrusive memories, avoidance, negative changes in mood and thinking, and heightened physical and emotional reactions. Recognizing these symptoms is the first step toward understanding and supporting those affected by PTSD. If you or someone you know is experiencing these symptoms, reaching out for professional help can make a significant difference. While PTSD can be overwhelming, recovery is possible with the right support and treatment. Many people find relief through therapy, medication, and support from loved ones. Understanding the symptoms is the first step toward healing. Remember, you are not alone, and help is available. With time, patience, and support, it is possible to regain a sense of safety, connection, and hope for the future.